हेलो स्टूडेंट्स, आज हम रिकॉल करेंगे FMT PYQ एम्स 2018। क्वेश्चन नंबर 1, which of the following is incorrect regarding the image shown? A, only the roots of this plant are poisonous. B, causes AV block. C, drug of choice for poisoning is atropine. D, मीठा जहर is one of the variety of this plant. इसका आंसर है A, only the roots of this plants are poisonous। तो इसका एक्सप्लेनेशन है ये। The image is of aconite. All parts of this plant, especially the roots and seeds, are poisonous. Varieties of these plants are monkhood, meetha zehar, bish, and bic. It is a cardiac poison and causes AV block, bradycardia. Atropine is used in the treatment of its toxicity. Next question है, a girl was allegedly kidnapped by a man. In court, she says that she is a major and is married to the man. X-ray images of her elbow, wrist, and pelvis are given. What is the approximate age of the girl? A, 14 to 15 years, B, 16 to 17 years, C, 18 to 19 years, D, 21 to 22 years. इसका आंसर है D, 21 to 22 years. Correct explanation है ये. The most approximate age of this girl is 21 to 22 years. Since the ischial tuberosity is fused in this scenario, the girl must be aged 21 years. Next question. First hand knowledge rule is applicable to A, common witness, B, handwriting expert, C, doctor, D, hostile witness. इसका आंसर है A, common witness. The first hand knowledge rule is applicable to a common witness who gives evidence about the fact observed or perceived by him. An expert witness is someone who has been trained or is skilled or has knowledge and experience and is able to draw conclusions from the fact observed by him. Doctors, handwriting, or fingerprints, firearms experts come under this category. A hostile witness is a person who is supposed to have some interest or motive for concealing a part of the truth or for giving completely false evidence. Next question. Crown rump length is 21 centimeter. Length of lower limb is 10 centimeter. Gestational age of the fetus will be A, 6 to 7 months, B, 4 to 5 months, C, 7 to 8 months, D, term. Correct answer is 6 to 7 months. Explanation है ये. Gestational age of this fetus is 6 to 7 months. Crown rump length plus length of lower limb crown heel length. Rule of Hasse enables the estimation of the age of the fetus in lunar months from its crown heel length in centimeter. According to the rule, age in months is equals to square root of crown heel length when the crown heel length is 25 centimeter or less, or first 5 months. Age in months crown heel is equals to crown heel length divided by 5 when the crown heel length is more than 25 centimeter or last 5 months. Here crown heel length is equals to crown rump plus lower limb length is equals to 31 centimeter. Hence gestational age 31 by 5 is equals to 6 to 7 months. Next question. Identify the correct pair: mummification, adipocere, marbling, or lividity of death. इसका आंसर है डी. इसका एक्सप्लेनेशन है ये. Image 1, marbling. It is the discoloration of superficial veins due to the formation of self-methanoglobin, which starts in 24 hours and becomes prominent in 36 to 48 hours. Image 2, lividity of death. Postmortem lividity, suggestion, postmortem hypostasis or postmortem staining or liver mortis, suggestion or VBC, develops in the dependent portion of the body due to engorged vessels showing through the skin. Image 3, mummification. It occurs in the absence of moisture in the air and continuous action of dry or warmed air. Image 4, adipocere. It forms under warm and humid weather due to hydrolysis of lipids. Next question. Match the following: heroin, eve, joint, LSD, ganja, acid, brown sugar and amphetamine. तो करेक्ट आंसर है डी, यानी हेरोइन, ब्राउन शुगर, heroin, brown sugar, and second eve, amphetamine, joint, ganja, LSD, acid. Next question. Which of the following trait is a feature of the female skull? A. Larger teeth. B. Frontal and maxillary sinuses are larger. C. Frontal and parietal eminences are larger. D. Supratympanic crest is present. Answer is C. Frontal and parietal eminences are larger. Frontal and parietal eminences are larger in a female skull. Question number 8. If a person starts to serve a second employer, the new employer is responsible for his actions by A. Vicarious liability, B. Doctrine of negligent choice, C. Contributory negligence, D. Borrowed servant doctrine. Consider D. Borrowed servant doctrine. Explanation है when an employee is being borrowed, the lending employer temporarily surrenders control over this worker and the borrowing employer temporarily assumes control. This is known as borrowed servant doctrine. Vicarious liability is by which the employer is responsible for his employees. Negligence if such activity occurs in the course of the employment and within its scope. Question number 9. Identify the following postmortem changes. A. Tattooing, B. Circulation, C. Putrefaction, D. Decomposition. Answer is circulation. The image shows circulation. Postmortem lividity develops in the dependent portion of the body due to engorged vessels showing through the skin. Question number 10. All of the following statements are true about the given condition except A. Swab should be taken immediately after moistening the sterile water. B. It is most commonly caused by incisors and canines. C. Photograph is taken with two scales at right angle to one another in the vertical plane. D. 3D imaging is possible in the given condition. Answer is C. Photograph is taken with two scales at right angle to one another in the vertical plane. The above image shows a human bite mark. The photograph is taken with two scales at the right angle to one another in the horizontal plane. Human bites are usually semicircular or concentric, caused by front teeth, incisors, or canine. Swab of bite mark should be taken immediately using a swab moistened with sterile water. A sample of the control area adjacent to the mark and of the victim's saliva should also be taken using swab moistened with sterile water. 3D imaging is done in which the image is measurable with high precision. A plastic substance such as rubber is laid over the bite mark, which produces a permanent negative cast. Question number 11. An 18-year-old girl was brought to the OPD. Genital examination revealed the findings as given below. These findings are indicative of A. True virgin, B. False virgin, C. Premenstrual stage, D. Molestation. Correct answer is B. False virgin. The given findings are suggestive of a false virgin. The examination findings of a separated labia majora, a flabby labia minora, and a porchet tear are indicative of forceful penetration. Hymen usually get ruptured with the first act of sexual intercourse. However, in some cases, hymen remains intact in spite of sexual intercourse. It is indicative of a false virgin. Question number 12. In case of professional misconduct, the patient's record on demand should be provided within A. 72 hours, B. 42 hours, C. 24 hours, D. 7 days. Its answer is A. 72 hours. In case of professional misconduct, the patient's record on demand should be provided within 72 hours. If a doctor does not maintain the medical records of the patient for a period of 3 years as per the regulation and refuses to provide the same within 72 hours, when the patient or his or her authorized representative makes a request for it, then it is a professional misconduct. Question number 13. A registered medical practitioner is requested by a survivor of sexual violence to examine her. Within what time must be the practitioner take a vaginal swab to look for the presence of spermatozoa? A. Within 72 hours, within 36 hours, within 5 days, within 48 hours. Answer A. Within 72 hours. Explanation है a vaginal swab of a rape victim demonstrates spermatozoa if the vaginal swab is taken within 72 hours after an assault. However, a vaginal swab can be taken within 96 hours to demonstrate semen evidence on the outside of the body, and on material such as clothing can be collected even after 96 hours. Question number 14. According to POCSO, aggravated sexual assault includes A. Sexual assault done by police officer, B. Threatening, C. Gang penetrative sexual assault, D. All of the above. Correct answer A. Sexual assault done by police officer. Sexual assault done by a police officer is an aggravated sexual assault according to POCSO, Protection of Children from Sexual Offences. The POCSO Act defines a child as any person below 18 years of age. It defines various forms of sexual offences which include sexual harassment, threatening, sexual assault, any act with sexual intent that involves physical contact without penetration, aggravated sexual assault, similar to sexual assault, along with the criteria explained under the term aggravated, penetrative sexual assault, an act with sexual intent that involves physical penetration of the penis or any object into the vagina, mouth, urethra, or anus. Aggravated penetrative sexual assault, similar to penetrative sexual assault, along with the criteria explained under the term aggravated. Pornography. Question number 15. Name the type of skull fracture. A. Depressed fracture. B. Hinge fracture. C. Pond fracture. D. Comminuted fracture. Correct answer is B. Hinge fracture. The image shows hinge fracture or motor cyclist fracture. Here the base of the skull is divided into two halves, each moving independently of the other like a hinge. Question number 16. Bullet fingerprinting involves A. Primary marking, B. Secondary marking, C. Both, D. None. Correct answer both. Primary markings and secondary markings. Bullet fingerprinting involves both primary and secondary markings. Primary markings are formed when a bullet passes through a barrel and the sides are marked by the rifling of the barrel, which is specific to the make and model of the gun. Irregularities on the inner surface of barrel itself, which are specific for that particular weapon, are also seen on the bullet and are called secondary markings. Question number 17. Identify the injury in the image below. A. Abrasion, B. Laceration, C. Bruise, D. Imprint. The correct answer is A. Abrasion. The image, the given image shows an abrasion. An abrasion is the most superficial of injuries. It does not penetrate the full thickness of the epidermis. A pure abrasion does not bleed, as blood vessels are confined to the dermis. However, the dermal papillae are corrugated in nature. Thus, many abrasions enter the dermis and bleeding commonly occurs. Question number 18. What is the cause of death in smoke inhalation? A. Histotoxic hypoxia, B. Ischemic hypoxia, C. Anemic hypoxia, D. All of the above. Answer is C. Anemic hypoxia. Victims of smoke inhalation are affected by carbon monoxide poisoning. In carbon monoxide poisoning, the cause of death is anemic hypoxia. Carbon monoxide has a higher affinity to hemoglobin compared to oxygen, and hence the amount of hemoglobin available for oxygen transport is markedly reduced. It displaces oxygen from its combination with hemoglobin and forms a relatively stable compound known as carboxyhemoglobin. It thus reduces the oxygen content of the blood and hence that of the tissue. It acts as a chemical asphyxiant and produces death due to anemic anoxia. It is important to note that in the case of anemic hypoxia, oxygen content is low, but dissolved oxygen is within normal limits, so it does not stimulate peripheral chemoreceptors. Question number 19. Paradoxical undressing is seen in A. Heat stress, B. Voyeurism, C. Hypothermia, D. LSD overdose. Correct answer is hypothermia. The phenomenon of paradoxical undressing is seen in hypothermia victims. Its occurrence is attributed to a paradoxical feeling of heat and may lead to an erroneous assumption of a sexual offense. Fatal hypothermia induces stupor, loss of powers of judgment, disorientation, and increasing incapacitation are associated with this phenomenon. Thank you so much.